Heart disease is a major cause of health problems and death in Australia and around the world. While it's associated with older people, it doesn't discriminate. Both men and women are at risk, and it can also affect younger people. In fact, the habits you form early in life can alter your risk of getting heart disease significantly as you get older. So what is heart disease? Heart disease isn't just one thing though, it's a category of the cardiovascular diseases. And it's a broad term that refers to a variety of conditions that affects the heart structure and function. These include things like coronary artery disease, arrhythmias, heart failure, and valvular disease. And also congenital heart disease, which is a condition that you're born with. Conditions like coronary artery disease, arrhythmias and disease of the valves can result from fatty deposits or plaques that build up over time, making the arteries more narrow. This process, known as atherosclerosis, restricts blood flow throughout our body and not just to the vessels in the heart. In some cases, when the arteries that supply blood to the heart get completely blocked, we can have a heart attack or go into heart failure. Plaque build-up and blood clots in the arteries that supply blood to the brain can also cause a stroke. How do you know if you have heart disease? Well, having less tolerance for exercise, like feeling short of breath even when you're doing light activity, can be a symptom of having heart disease. Other early symptoms include things like high cholesterol, which we look at by measuring the lipid levels in our blood, and having high blood pressure. Importantly, we may not feel these symptoms, but they can be picked up through regular monitoring with your doctor. A classic sign of the blood flow to your heart being restricted by heart disease is chest pain and discomfort, which can go up into your jaw, into your shoulder, really anywhere in your chest when you're doing light exercise like walking up a flight of stairs. This is serious and you should see your doctor about any unexplained chest pain. Leg pain that is worse with exertion can be a symptom of peripheral vascular disease or PVD. This involves a narrowing of the peripheral vessels, which are the vessels situated away from the heart and the brain. What causes heart disease? Smoking and exposure to secondhand smoke is a major cause of heart disease because it speeds up the clogging and the narrowing of the coronary arteries and also affects your blood pressure and the capacity to transport oxygen in your blood. While less is known about the long-term risks of vaping, many e-cigarettes contain nicotine, so they can well have similar effects as seen with cigarette smoking. High cholesterol levels and high blood pressure are also major contributing factors for heart disease. High cholesterol can result in fatty deposits building up in your arteries, which can then impair blood flow. And high blood pressure can put extra strain on your heart and damage your arteries by making them less elastic, which decreases the blood flow of oxygen to your heart. What are the risk factors of developing heart disease? There are what we call modifiable and non-modifiable risk factors that can increase or decrease your risk of heart disease. Modifiable ones are general lifestyle factors like exercise, diet and smoking that can impact on your blood pressure and cholesterol levels. Stress may also be a contributing factor, although there's not so much clear-cut evidence about this as a cause. Non-modifiable things are those which we can't change, although we can monitor them. You cannot change the genes your parents gave you, and we know that heart disease does have a genetic component, so knowing if there's a history of heart disease in your family is important, and that you consider this when talking to your doctor about your risk. Having metabolic conditions like diabetes can also increase your risk. Age is another risk factor. As we get older, we may be more likely to do less exercise and we have higher blood pressure and lipid levels. While we can't modify our age, we can consider habits that we form when we're young, which then can have a big impact on our likelihood of getting heart disease as we get older. The build-up of fatty deposits in your arteries can start when you're very young, so that by the time you reach middle age, they can be quite advanced. How do you treat and manage heart disease? The work that we do at Griffith University examines the benefit of regular exercise in minimising the risk of developing the disease and in helping people manage their symptoms after diagnosis. We know that people who exercise regularly have lower risk of developing heart disease, and we also know that once you have a cardiac event, like a heart attack, that you are better off in the long term if you exercise regularly. There is a myth out there that if you have heart disease, you have to take it easy, but this isn't the case. We know that exercise training through, say, a structured rehab program is beneficial, and that following a cardiac event, a rehab program can improve your quality of life. Rehab programs for cardiac patients are highly effective. Most programs focus on cardio, with activities like walking and cycling, but resistance and strength training are also beneficial. This can also have other benefits, especially as we age, in decreasing the risk of falls and conditions such as osteoporosis. It's not all about exercise, and other modifiable risk factors are managed through diet, medication, and regular monitoring of blood pressure and blood lipids. Stopping smoking is another modifiable risk factor that should be adopted. What medical treatments are there? Doctors may prescribe medication to help manage blood pressure and your cholesterol levels. And if you've had heart disease or a heart attack or heart failure, then other medications can be used to improve your heart function and to improve your quality of life. In cases when heart disease is quite advanced and people have significantly blocked vessels, surgery may be required. This could mean inserting a stent, which is a metal clip that can go inside the vessel and keep the artery open. In cases when the vessels are extremely blocked, then coronary artery bypass surgery may be performed to improve the blood flow to the heart. When valves in the heart are damaged or leak, then they can be repaired or replaced to help improve heart function. Once your heart tissue is damaged though, it doesn't grow back. In extreme situations, a heart transplant might be needed. How can I prevent heart disease? Heart disease is serious, but taking preventative measures can drastically reduce your risk. The best way to detect signs of heart disease is by seeing your doctor regularly to monitor your risk factors. You should also be aware of your family history and manage any other non-modifiable risk factors such as diabetes. Being physically active, having a healthy diet and managing your blood pressure and cholesterol levels will also reduce your risk of getting heart disease. Even if you do have heart disease, then these activities can minimise the impact that heart disease has on your life, and it can decrease the risk of it progressing and causing something more serious like a heart attack.